Hi guys, welcome back. It's Dr. Saru. I'm glad that you're joining in today. As usual, Tuesdays is where it all goes down, matters health talks. And today I have a topic that I want to discuss, something that has been shunned off. People are not talking about it. We assume as if it's normal. Oh, ni kawaida, usikuwe na wasiwasi. After all, it's just once in a month that you get the pain. And yeah, and I don't think it's supposed to be ignored as the way people have been ignoring it. I know some people have been giving light to endometriosis only, but did you know it's not actually supposed to be normal for somebody to have painful periods? And did you know that somebody should not be shamed for having painful periods? We're supposed to look for help and methods of how we can help the person to have a good experience during their period. Of course, there's so many changes, hormonal and whatnot, and psychological aspects that goes into it when a woman is getting her period. But of course, there's so much that you can do to at least help and make our women, our mothers, our sisters, ourselves feel better. So today, without much further ado, let's jump right in and talk about dysmenorrhea. So you'll ask yourself what dysmenorrhea is. Dysmenorrhea is just simply, in layman terms, painful periods or pain during period, or what commonly is known as cramping. So for dysmenorrhea, there are normally two types. There is the primary dysmenorrhea and secondary dysmenorrhea. I'll go into depth of each and try to describe so that you can understand what the primary dysmenorrhea means or what it's about and what secondary dysmenorrhea is. So let's get into it. Primary dysmenorrhea basically means there's no issue with your pelvic organs, or there's no organic cause that is making it happen or making you have the pain during your period. In most cases, you see primary dysmenorrhea in girls who are just starting out their period. So you'll find out that when you first have your period, you immediately, when you get the first period, it has pain, and throughout maybe your life, you keep having pain during period. Though there's some studies that shows that the more you continue growing, the pain sort of lessens, or when you have kids also, at some point the period pain becomes much bearable. Now that is for primary dysmenorrhea. There's so many theories that have been postulated as to what actually happens or what causes the primary dysmenorrhea to happen, including psychological cases, as I'd mentioned earlier. But the one theory that most people follow, or most people want to abide by, sort of, it's the prostaglandin theory. What it said, or what is known, is during your period, your uterus produces prostaglandins. So when the prostaglandins are produced, they're the ones that cause the pain, basically. So plenty of the prostaglandin tends to cause pain. It's like a pathway that happens, and then now you start feeling the pain while you're having your period. So that is for what is it? For primary dysmenorrhea. The other thing that has been told to be seen in primary dysmenorrhea, it is for people who also are obese, or a girl child who's obese by the time they're in puberty and then they start their period. For girls who also do smoke, it's been shown that they might have painful periods. The other thing, family history. Yeah, family history. For people who maybe your mom, your auntie had period pain or cramping, or has been having period pain and cramping, it is also common that you might develop the period pain while you start your own period. And the other thing to note is, if you started your period earlier than when you're 12 years, before you're 12 years, so maybe you started your period when you're 10 years or 9 for some cases, 11, you tend to have the primary dysmenorrhea, as opposed to the girls who start their periods maybe when they're 15 or 16. And yeah, so basically that's it. And also for period pain is worse for women who also don't have children yet. So the primary dysmenorrhea is also worse for people who, or ladies who don't have children. As I told you earlier, it tends to lessen, or it tends to become more bearable as age progresses, one, and when you have children. I know people have been told this about it, and someone keeps on telling you, just have babies and the pain will go away. But we can manage the acute pain now while you're thinking about babies. Isn't that right, ladies? You don't have to be having pain and being forced into having children just because you want to take care of a period pain. And it's not even 100% sure that when you have the babies, your pain is going to be less. So now that we've known for primary dysmenorrhea, it does not necessarily have an organic cause. It is because of prostaglandins and psychological aspect of it. You might want to ask yourself, what about then the secondary dysmenorrhea I was talking about? So for secondary dysmenorrhea, you notice it's called secondary. So meaning it didn't happen when you started your period. It sort of comes along. Initially, you started your period, it was that normal cramping here and there, and the nausea here and there, and then it keeps ilikuwa tu sawa, and then after a while, from nowhere, you just start developing this severe pain, and it becomes so severe that you wonder where it could have come from. So in most cases, some people normally have not had any signs of the period that is painful, and then later on it sort of comes. Yeah. Oh, actually, in some cases, not necessarily it has to happen like you had your period and it was painless, and then after that it comes to be painful. No, it could happen that way because there are several causes of it, of which I'm going to discuss with you each and every one. Sometimes you can just have painful, really painful periods from the word go, and it's because you have a pelvic organ issue. So what are the commonest causes of secondary dysmenorrhea, you can ask? The commonest cause is normally endometriosis. What it means by endometriosis is the lining of the uterus, or the endometrium, is anywhere else other than in the uterus. So you have it in the uterus, and you can find it in sometimes in the nose, in the brain. When it gets to the brain, it's normally very bad. Brain, in the lungs, you can find it in the vagina, in the ovaries. So every time it's that time of the month, there's so much of that pain, which is extremely excruciating, and in most cases it even happens to start even before your menses come, and even after your menses come, you still have some of those symptoms like bloating and feeling very uneasy, and even the nausea can be on in most cases. So for endometriosis, it's something that needs your doctor to diagnose you with it, so that you can work with your doctor to know what are the treatment options that are available for you, because it's something that not 100% treatable depending on where the site is, but in most cases it is manageable. So of course, if you have painful periods, before you assume it is just the usual kawaida pain, go to your gynecologist or go to your general practitioner first before they decide to either escalate it to the gyna, and get your tests done to see if it is secondary dysmenorrhea or primary dysmenorrhea, because now there's a big difference in line of management depending on if it's primary or if it's secondary dysmenorrhea. So we found out the first reason as to why you can get or you can have secondary dysmenorrhea. The second reason that you can have or can get secondary dysmenorrhea from, this is pelvic inflammatory disease, or PID. So for pelvic inflammatory disease, what you realize is initially you never had much pain, or you didn't have pain at all during your period, and then after you contract this infection, the pelvic inflammatory disease is not just like we call it one like that, but there's definitely some causes that can lead to the PID. So once you have contracted the infection, and then now it's when you start realizing, when you get your menses, they're quite painful, but previously you didn't have painful menses. So again, you need your doctor to check you out and help you, because if the PID is settled and it's treated, which is very much 100% treatable, you'll find that now you can resume back to your easy pain-free menses. The other thing is adenomyosis. So what happens with adenomyosis, it's almost like endometriosis, only that now the lining of the uterus, that is the endometrium, is in the muscular layer of the uterus, the myometrium. So every time you're having your period, you're bleeding inside the muscles of your uterus, which can really be painful, and also that you need your doctor to diagnose it so that you can check and see what options you have. Other things that have been associated with with secondary dysmenorrhea is things like Ashman syndromes, cervical stenosis, and the list is quite a bit long, not very, but it's quite. And I'm not going to be talking about all that because I wanted you guys to have the picture and to understand between primary and secondary dysmenorrhea and what are the treatment options for both. But before we go to the treatment options, one of the things I'd like to talk about is the signs and symptoms. For every woman, it's normally very different. Of course, pain is key, the cramping, and in most cases, people will explain the pain. It starts from the lower back, and it's a very sharp pain coming to your lower abdomen. Sometimes it can be stabbing in nature, and of course, if you're having the heavy menses that also sometimes happen to have clots, when you have to pass those clots down, you know, your uterus has to contract to allow the clots to pass down. It can be really painful for the girl or for the lady or for the woman who's experiencing that. Other associated symptoms can be nausea, bloatedness. Some women also complain of diarrhea. Actually, others do vomit during that time because GI motility is normally very high. That is the work of prostaglandins, again doing the same. So not necessarily all the time it will be the sharp pain on the lower tummy. Can be that associated with the lower back pain. There's some people who get it so severe that they keep complaining. If somebody has ever given birth before or they've had stories about labor, they might think it's like an actual labor, especially when you have to pass down the clothes. So now that we've known the signs and symptoms, how can you know then you have primary dysmenorrhea or you don't, or it's secondary dysmenorrhea? Actually, any pain that you feel is not bearable and affects your quality of life or your daily routine, it's pain that you need to go see your doctor for it to be managed. You can be taking painkillers all the time from home and you don't know, maybe you have secondary dysmenorrhea and you've been thinking it's just primary dysmenorrhea without actually being examined by the doctor. So some of the routine tests that we do, you can do an ultrasound. It can be of importance, especially if you're trying to rule out if it's a secondary dysmenorrhea, because if it's PID, of course, there's features that will be suggestive of a PID. There's going to be fluid at the porch of Douglas. So many things that we can see from that will tell us if it can be one thing or another. And once the doctor has told you now this is primary dysmenorrhea, of course you can relax, and the doctor can take you through the process of what can be done and how it should be done, so that at least you end up enjoying your periods, if at all that is a thing. Because I think it's a good thing to enjoy being a woman, don't you agree? And to enjoy feeling, okay, I know I'm on my periods, but I don't have to be feeling so bad about it, the fact that I'm on my period. Now guys, I know it's a lot to bear, from knowing what it can be to what it is, what are the risk factors that are involved in getting even primary dysmenorrhea. You want to know the treatment options. So there are things that you can do at home, and there are things that the doctor can prescribe to you to help or make the experience less of a burden to you and less painful. The first things I want to talk about, three key things you can do from home that can help with lessening the pain or helping to make you pain-free during your period. One thing, exercise. I know even previously when I was doing this video, I was telling you things that you can boost your memory with. Exercise, I think, was number one. I know it's something that we constantly say, and most of us doctors fail to exercise. Personally, I'm trying to be on track. But yes, exercise is one of the things that can help you to lessen the pain, because again, it activates your good hormones, endorphins. It makes you feel good, makes you feel energetic. And when I mean exercise, I don't literally mean you go out for a run or a jog. What you can do, for starters, you can just do meditation, you can do yoga, it's still exercise. You can do some stretching exercise of the pelvis, helps to release and make you feel better, and it relaxes you so that you don't actually concentrate much on the pain. And even the stretching exercises are good to help with managing the pain. That is one. Number two, hot compressors or hot water bottle, or heat therapy. What it does, it helps, it warms your tummy. You put it under rather you put it on your lower tummy, or you can put it on your back depending on where hurts the most, and you'll realize it starts to relax you, and you start to feel quite warm, and you start to feel nice, and you start to feel more of the pain disappearing. One thing I should, however, emphasize about that is, please, when you're doing the heat treatment, if it's a hot water bottle, the one you bought from the supermarket or from the market, or one that you have decided to improvise, don't put it directly on your skin, because it can end up affecting your skin or even burn you, and we don't want you to get burnt. We just want you to have the heat treatment that can help you to make the pain a bit bearable. So make sure either you wrap the bottle with something if it's not wrapped up itself, or it's not put in a clothing like cushiony thing. If not, you just make sure you wrap it up in a lace or something, and make sure you're also wearing a shirt or something, so that when you're sleeping on it or you're putting it on your tummy, it doesn't actually come in direct contact with your skin, to avoid hurting yourself or getting burnt. The third thing is position. The curling up position and lying on your stomach. For most people, they have said they get actual relief when they lie on their fours and on their stomach. I will put up a picture here so that you can be able to see what exactly position I'm talking about. So once you're lying down in that position, it helps to also, it's just like also part of the stretching exercises, because it kind of reduces the pain. Because most people who have done studies on it, and from other females who actually have tried the position, say it actually helps them during that time. Another thing, just to add on top to the list, I know I said 3 things, but the 4th thing, which is my ultimate favorite, warm milk. It does the trick for most of us, including myself. You take a glass of hot milk, not hot, warm milk, and after you do your milk or drink your milk, you go down, lay for a while. After you wake up, you realize you're much relaxed, and even the pain has subsided, and it's now better. Now you ask yourself, okay, I've tried all this, my pain is really excruciating. Doctor has told me it's just primary dysmenorrhea, so there's no organic cause for causing my pain, but after doing the positions and all whatnot, it's still not helping. So what we normally do at the hospital, we give things called NSAIDs, which are just analgesics or just painkillers, which are called non-steroidal anti-inflammatory medication, which is really nice to help combat the pain. So you can either do Ponstan, or which people know as mefamic acid, or you can do Brufen, the commonest for most people around, I know. In most cases, if your pain is not responding to just the NSAID, that is the Brufen or any other that you can take, you can always add with a paracetamol if it's that bad. They give each other synergetically, and they help in getting the pain, in managing the pain and getting proper pain control. So you can do a Brufen and a paracetamol together, and that will be good enough for you. If you're not in the you can be in the reproductive age, but you're not really interested in getting children, at that particular time of your life. You can also do oral contraceptives. What they do, they stop ovulation, and while ovulation has been stopped, it helps also reduce the pain. Your periods seem to have much of an order, and yes, and you actually can manage and predict when your periods are coming, and you can be well prepared for when your periods are coming. And the third thing that also can be incorporated into the whole pain management by your doctor, the things we called IUC, intrauterine systems. Intrauterine systems are not the same as IUD. I know people might confuse this. IUC is a plastic. It's almost like the coil, but it's not copper. It's plastic. And that also helps to manage the pain. Most women say from up to after like a year or 6 months of being in that particular device, they tend to get very much good good control of the pain, and the periods are also quite manageable. Now, you'd ask, for secondary dysmenorrhea, for example, what do we do? Now, if it's PID that caused the dysmenorrhea, of course, the doctor will put you on some drugs, which are antibiotics, and for some few days, and after the disease or the inflammation has been treated and is gone down, you'll realize that now you start to feel better. And after a while, after you're done with the treatment, the next subsequent periods are going to be much manageable, and the pain is going to be well controlled, and you're going to feel much better about it actually. And for the other things, of course, for endometriosis, adenomyosis, sorry, your doctor will plan according to it's really patient based or individual based. There's no one shoe fit it all size kind of thing. It's what is needed to be done for you is what will be done after your doctor has explained to you exactly the nature of your issue and what the problems were. I hope from today onwards, our fellow women will take much more seriousness when they start getting those pains, instead of just assuming it's just normal, it's okay, I always have pain, I can sleep, I don't have to go to work, I can take a sick off, without actually knowing if it's primary or secondary dysmenorrhea. And now, for the men, gentlemen, please, I hope you understand better that it can be some actually other big things that are causing life-threatening things that could be causing the pain, and not necessarily just period pain, like how people have just been calling it. It's not just period pain. It is actually period pain, and it's really painful. And it's high time it gets the recognition that it deserves. Until next time, I hope you've learned something new. It's Dr. Saru. Love and love.